Wait, before you scroll away, I need you to listen to me for just 1 minute. This could be the most important minute of your day. If you are over 60 years old, what I am about to tell you might change the way you see the world. Literally, because right now, while you are sitting there watching this video, your eyes could already be losing their vision, slowly, quietly, without making a single sound. And here's the scary part. You will not feel any pain. You will not see any warning signs. Nothing will tell you that something is wrong until one day you wake up and the world looks blurry. Faces look unclear. Reading becomes hard. And by then, it may be too late to fully fix it. Most people just blame it on old age and ignore it completely. They think it's normal. They think nothing can be done. But that is exactly the mistake that costs people their eyesight. The truth is, there are 7 hidden things happening in your daily life right now that are silently stealing your vision, one day at a time. Some of these things you do every single day without even realizing the damage they are causing. And one of them on this list is so common that almost everyone over 60 is making this mistake right now, including maybe even you. So if you want to protect your eyes, keep your independence, and still be able to see clearly your grandchildren's faces, your favorite book, the sunset in the evening, then do not skip this video. Watch it till the very end, because number 4 on this list is the one nobody talks about. And when you hear it, it will completely shock you. Stay with me. Let's get started. Hello, I am Dr. John Wellness. And in today's video, we are going to uncover the 7 silent things that are destroying your eyesight after 60. And more importantly, exactly what you can do, starting today, to protect your vision before it is too late. Hidden eye thief number 1, age-related macular degeneration. This is one of the most common reasons people over 60 lose their central vision. And most of them never see it coming until it's already too late. Here is how it usually starts. You are reading a book or looking at a clock on a wall or trying to recognize a face from across the room, and suddenly the middle of your vision looks a little blurry, a little wavy, almost like you're looking through a foggy window or a window with raindrops on it. At first, you might think, I just need new glasses. Or maybe, I'm just tired today, it will be fine tomorrow. So you ignore it. You wait. You tell yourself it will go away on its own. This is the exact mistake that millions of people make every single year. But here is the truth. Macular degeneration does not go away on its own. It does not take a day off. It slowly, quietly gets worse, week after week, month after month. And it attacks the most important part of your eye, a small area called a macula. This tiny part of your eye is responsible for your sharp, central vision. It lets you read words clearly. It lets you recognize faces. It lets you see fine details and colors the way they are meant to be seen. Without it working properly, something strange happens. You can still see the outside edges of things. The side vision stays mostly normal. But the center, the most important part, the part you actually focus on, slowly starts to fade, blur, or even disappear completely. Now, just imagine this for a moment. Imagine trying to look at your own grandchild's face and not being able to clearly see their eyes or their smile, no matter how hard you try. Imagine wanting to read a letter from a loved one, but the words in the middle of the page are just a blur. That is what this condition can quietly do to you if it is left untreated, ignored, or caught too late. So, what are the early warning signs that you should never, ever ignore? First, straight lines like door frames or window edges start to look bent, curved, or wavy. Second, colors around you start to seem duller, less bright than they used to be. Third, you find yourself needing brighter and brighter light just to read normally. And fourth, you start struggling to recognize faces clearly, even people you have known your whole life. If even one of these signs sounds familiar to you, please do not wait another day. See an eye doctor as soon as you possibly can, because the earlier this condition is caught, the more of your precious vision can actually be saved and protected. But this is only the first thief on our list today. The next one is even more dangerous, even sneakier, because doctors are giving it a very dark, very serious nickname. They call it the silent thief of sight. Hidden eye thief number 2, glaucoma, the silent thief of sight. Doctors did not give this condition a scary nickname for no reason. They call glaucoma the silent thief of sight because of one terrifying fact. It can steal your vision without any pain, without any warning, and without you even noticing, until a large part of your eyesight is already gone forever. Here is what happens inside your eye. Glaucoma slowly damages something called the optic nerve. Think of this nerve like a cable, a wire, that carries everything your eye sees straight to your brain. When this nerve gets damaged, the connection starts to break down. And once that damage happens, it cannot be reversed. It cannot be undone. Whatever vision is lost forever. Now, here's the part that makes glaucoma so dangerous. Unlike a headache or a toothache, glaucoma usually does not hurt. There is no warning pain telling you something is wrong. In the early stages, you might feel completely normal. You might think your eyes are perfectly healthy. Meanwhile, behind the scenes, pressure could be quietly building up inside your eye, slowly crushing the optic nerve, day after day. By the time most people notice something is wrong, it's often because they've already lost a large part of their side vision, what doctors call peripheral vision. They might start bumping into furniture they've had for years. They might miss seeing a car coming from the side while driving. They might trip over things that used to be easy to see. And by this point, a significant amount of vision may already be permanently gone. This is exactly why regular eye checkups become so important after the age of 60. A simple, painless test at the eye doctor can measure the pressure inside your eyes and check the health of your optic nerve long before you ever feel any symptoms yourself. So what should you watch out for? Difficulty seeing things to the side, while your central vision still looks normal. Seeing halos or rings around lights, especially at night. Eye pain or redness in some cases. And a gradual loss of vision that creeps in so slowly, you might not even realize it's happening. The good news is this. If glaucoma is caught early, doctors have effective ways to control it, slow it down, and protect the vision you still have. Eye drops, medication, and in some cases, simple procedures can help save your eyesight for many more years to come. But if it goes undetected, if you skip your eye exams, if you ignore the small warning signs, glaucoma can quietly take away your vision piece by piece until one day you realize just how much you've already lost. That is why this thief is called silent. It does not announce itself. It does not warn you. It simply steals. And our third thief on this list works in a completely different way. This one does not hide in the dark. Instead, it slowly clouds everything you see, like looking through a dirty window that never gets cleaned. Hidden eye thief number 3. Cataracts, the cloudy window you never notice. Imagine looking through a window that slowly, over many years, starts collecting dust, fog, and grime so slowly that you never actually notice it happening. That is exactly what a cataract does to your eye. Inside your eye, there is a small, clear lens. This lens is what allows light to pass through properly, so you can see the world sharp and clear. But as we get older, this lens can slowly start to turn cloudy. Doctors call this a cataract. And just like that dusty window, it happens so gradually, most people don't even realize it's happening to them. At first, the signs are so small, you might not even pay attention. Colors might start to look a little faded, a little less vibrant than they used to be. Reading in dim light might start to feel harder than before. Bright lights, like car headlights at night, might start to seem more glaring, with strange halos around them. You might even find yourself needing to change your glasses prescription more often than usual. Slowly, over months and years, the cloudiness increases. Things that used to look sharp now look hazy, foggy, almost like you're looking through a frosted glass shower door. Many people describe it as feeling like they are always looking through a dirty pair of sunglasses, no matter how many times they clean their lenses. Here is what makes cataracts tricky. They develop so slowly that your brain actually starts adjusting to the blurriness. You don't realize how much vision you've lost until something happens. Maybe you finally get a cataract removed in one eye, and suddenly, when you compare it to your other eye, you are shocked by just how much clearer, brighter, and sharper everything looks. Many people say it's like seeing the world in high definition for the very first time in years. The good news about cataracts is this. Unlike some other eye conditions on this list, cataracts are highly treatable. In fact, cataract surgery is one of the most common and most successful procedures performed today. It's quick, it's safe, and for most people, it can restore vision back to where it used to be, sometimes even better than before. But here is the catch. Many people wait too long. They get used to the blurriness. They tell themselves it's just part of getting older, and they push off seeing a doctor year after year. Meanwhile, their quality of life slowly declines. Driving becomes harder, reading becomes harder, even recognizing faces from a distance becomes a struggle. So if you've noticed your vision getting cloudy, your colors looking duller, or lights at night seeming overly bright with glare, don't wait. A simple eye exam can tell you exactly what's going on and how easily it can be fixed. Now, our fourth thief on this list is the one I promised you at the very beginning of this video. And trust me, once you hear what it is, you will understand exactly why it shocks so many people just like you. Hidden eye thief number 4, diabetic retinopathy. The shocking one. This is it. This is the one I told you about at the very beginning. And once you understand what it actually does, you'll understand why so many people are completely caught off guard by it. Here is the shocking part. Many people don't even realize that diabetes, a condition that affects your blood sugar, can also be silently destroying your eyesight at the very same time. Most people only think about diabetes affecting their energy levels, their weight, or their heart. But very few people realize it can also be quietly attacking the tiny blood vessels inside their eyes right now, even if they feel completely fine. Here's what's happening. When blood sugar levels stay high for a long period of time, it slowly damages the tiny, delicate blood vessels inside your retina, the part at the back of your eye that's responsible for capturing everything you see. These damaged blood vessels can start to leak, swell, or even close off completely. And in more advanced cases, the eye tries to grow new blood vessels to compensate, but these new vessels are weak, fragile, and can bleed easily, causing even more damage. The truly shocking part is this. In the early stages, diabetic retinopathy often has no symptoms at all. 0. You could have perfect vision today, and significant damage could already be happening behind the scenes, completely invisible to you. By the time you actually notice blurry vision, dark spots floating in your sight, or even sudden vision loss, the damage may already be quite advanced. This is exactly why this thief is so dangerous. It hides behind a condition that millions of people over 60 already have, sometimes without even knowing it. In fact, many people are first diagnosed with diabetes because their eye doctor noticed changes in their retina before any other doctor caught it. So who is at risk? Anyone with diabetes, especially if blood sugar levels haven't been well controlled over the years. But even people with mild or borderline diabetes can be affected over time. What can you do? First, if you have diabetes, get a dilated eye exam at least once a year, even if your vision feels perfectly fine. Second, keep your blood sugar levels as stable and controlled as possible through diet, medication, and your doctor's guidance. And third, never ignore any sudden changes in your vision, no matter how small they may seem. The good news is, when caught early, treatment are available that can slow down or even stop further damage to your eyes. But once vision is lost from advanced diabetic retinopathy, it often cannot be fully restored. That's why this one shocks so many people. It's not some rare, unusual condition. It's connected to something millions of people are already living with, often without realizing the silent damage happening inside their eyes right now. Now, let's move to our fifth thief on this list, one that might surprise you because of how simple and how common it really is. Hidden eye thief number 5, dry eye syndrome. Now, this one might surprise you simply because of how common and how harmless it sounds. Dry eyes. Most people think it's just a minor annoyance, a little irritation, nothing serious. But for many people over 60, chronic dry eye can quietly affect your vision more than you ever realized. Here's what's actually happening. As we age, our eyes naturally start producing fewer tears, and the tears we do produce often don't have the right quality to keep our eyes properly lubricated. Without enough moisture, the surface of your eye can become irritated, inflamed, and even slightly damaged over time. At first, the symptoms feel simple: a burning sensation, a gritty feeling like there's sand in your eye, redness, sensitivity to light. maybe even watery eyes, which sounds strange, but is actually your eye's way of overreacting to dryness. But here's what most people don't realize. When dry becomes chronic and goes untreated for years, it can actually start to affect the clarity of your vision. Your eyesight might become blurry on and off throughout the day, especially after reading, watching TV, or using a phone or computer screen for too long. The surface of your eye, which needs to stay smooth for clear vision, becomes uneven and irritated. Certain things make this worse, especially for people over 60. Spending hours looking at screens. Certain medications, like blood pressure pills or antihistamines. Indoor heating or air conditioning. Even some health conditions can make dry eye worse over time. The good news is, dry eye is one of the easiest problems on this list to manage. Simple solutions like using preservative-free artificial tears, taking regular breaks from screens, using a humidifier at home, and staying properly hydrated can make a huge difference. In more severe cases, your eye doctor can recommend specific treatments to help your eyes produce better quality tears again. So if your eyes often feel dry, irritated, or your vision seems to blur on and off throughout the day, don't dismiss it as something small. It could be quietly affecting your comfort and your clarity more than you think. Now, let's move on to our sixth thief. And this one might genuinely surprise you, because it could be hiding inside your own medicine cabinet. Hidden eye thief number 6. The medications in your own cabinet. This one might genuinely surprise you, because the danger isn't outside your home. It's sitting right inside your medicine cabinet. Many common medications, ones millions of people over 60 take every single day, can have side effects that quietly affect your vision over time. And most people never even think to connect the two. Certain blood pressure medications can cause blurry vision or dry eyes. Some cholesterol medications have been linked to vision changes in rare cases. Steroids, even ones used for arthritis or other conditions, can increase your risk of developing cataracts or glaucoma if used for a long period. Even some antihistamines, the ones used for allergies, can reduce tear production, making dry eye worse. Here's the tricky part. Most people taking these medications never connect their blurry vision or their dry eyes to the pill they took that morning. They assume it's just their eyes getting older, when really, it could be a side effect that's worth discussing with their doctor. This does not mean you should stop taking your medication. Please, never do that without talking to your doctor first. What it does mean is that you should stay aware. If you notice new vision changes after starting a new medication, mention it to both your doctor and your eye doctor. Sometimes a simple adjustment or an alternative medication can make a real difference. The best habit here is simple. Get regular eye exams, and always tell your eye doctor about every medication you're currently taking, even ones that seem unrelated to your eyes. This small step can help catch problems early, before they cause permanent damage. Now, let's move on to our seventh and final thief on today's list. And this one is something almost everyone overlooks completely. Hidden eye thief number 7, poor nutrition. The one almost everyone overlooks. And finally, we've reached the last thief on our list. This one isn't hiding in a disease or medication. It's hiding in something far more ordinary, your daily plate of food. Your eyes, just like every other part of your body, need specific nutrients to stay healthy. And as we age, our bodies often become less efficient at absorbing these nutrients, even if we think we're eating well. Certain vitamins and nutrients play a direct role in protecting your vision. Vitamin A, which helps your eyes adjust in low light and protects the surface of your eye. Lutein and zeaxanthin, two powerful nutrients found in leafy green vegetables, which act like natural sunglasses, protecting your retina from damage. Omega-3 fatty acids, found in fish, which help support tear production and reduce inflammation. And vitamin C and E, which work as antioxidants, protecting your eyes from the kind of damage that leads to cataracts and macular degeneration. When your diet lacks these nutrients, over months and years, your eyes lose an important layer of natural protection. This doesn't cause sudden vision loss. Instead, it quietly increases your risk for almost every condition we've talked about today, from macular degeneration to cataracts to dry eyes. The good news is, this is one of the easiest thieves to fight back against. Adding more leafy greens like spinach and kale, colorful vegetables, Fish like salmon, eggs, and nuts to your diet can make a real difference over time. In some cases, your doctor might also recommend a specific eye health supplement, especially if you're not getting enough of these nutrients through food alone. Your eyes are not separate from the rest of your body. What you eat today is quietly shaping how clearly you'll see 5, 10, even 20 years from now. And that brings us to the end of our list. 7 silent thieves, all working quietly, all capable of stealing something as precious as your eyesight, without you even realizing it until it's too late. But now, you know what to watch for. And that knowledge is a first step to protecting your vision for many more years to come. So now you know the 7 silent thieves stealing your vision after 60. The best protection is simple. Get a full eye exam at least once a year, even if you feel fine. Eat foods rich in vitamins for your eyes. Control conditions like diabetes and blood pressure. And never ignore small changes in your vision, no matter how minor they seem. Your eyes let you see the people you love and the world around you. They deserve to be protected. If this video helped you, hit that like button and let me know in the comments which of these 7 thieves surprised you the most. Don't forget to subscribe so you don't miss next week's video. Take care of your eyes. I'll see you in the next one.